10. It is a topic not so easy to talk about, but remains a relevant issue in the Gem State, and that is the scourge of suicide. Alarming recent statistics now prompting local prevention groups to step up and target their efforts. In tonight's Finding Hope, 6 on Your Side's Madeline White joins us with more on how one organization is expanding their oversight over vulnerable Idahoans.
That's right, Roland. The Department of Health and Welfare released a report saying Idaho has the 8th highest suicide rate in the country. Now, the Idaho Suicide Prevention Hotline is boosting their outreach.
Idaho Suicide Prevention Hotline.
All day long, staff at the Idaho Suicide Prevention Hotline take calls from Idahoans who are in crisis, are feeling suicidal, or are just needing someone to talk to.
Mental illness, substance abuse, grief and loss, intimate partner violence.
But these volunteers aren't just taking calls, they're also making them.
In addition to record numbers of inbound calls this year, we're also doing record numbers of outbound follow-up calls.
And recently they began making calls with specific target audiences in mind.
In the last few years, we've expanded that service to provide it to patients that are discharging from hospital emergency departments.
This is not only including patients being discharged from ERs, but also crisis centers, Ada County Jail, and inpatient behavioral health centers.
When we get out of the doctor, we get a sheaf of papers and a list of contacts and appointments and things, and you know, even the best of us don't always make those appointments or make those follow-up calls.
With outbound calls to those who are most at risk.
It's a reminder to follow up with those recommended appointments.
They're expanding their oversight in hopes of saving lives.
It's a safety check and it's emotional support.
And John says so far, it's working. What
we found and what the research is finding is that people that receive this discharge follow-up contact from a crisis center, they do better. They have fewer suicide attempts post-discharge. They have lower readmission rates, so people aren't coming back to the ER within a few more days or weeks, and they're making their appointments.
And Roland, John says right after the holidays, every year they see an increase in call volume.
I would imagine so. It's a tough time of year for a lot of people. So does that mean they need more people to help out?
Yes, they do. And actually, they are accepting applications tonight for their winter 2020 training session. They're always looking for phone responders all year round, though. So if you're interested, you can find more information on our website, 6onyourside.com.
All right, we hope a lot of people take advantage of that. Thanks. Well.